Welcome to the Prospective Doctor Podcast, brought to you by Med School Coach. Pre-med and medical students alike are encouraged to tune in each week for tips on how to become a strong med school candidate, gain acceptance into the school of your dreams, and succeed on your journey toward residency and becoming a doctor.
Hello, everyone. I'm super excited. Today we have a very special guest, Dr. Liz Aguirre. And I'm just going to let her tell us a little bit about herself.
Hi, everyone. Thanks so much for being on the show today and listening. I'm really excited to talk about my journey into medicine and tell you a little bit about myself, because I had a very atypical path to becoming a physician. And I think that this may be very relatable to a lot of the prospective students who are struggling with whether they should apply, or maybe have been told you should wait a year or you need to do XYZ before you apply. But I actually grew up in a very poor home, and we grew up in a very poor community. And I really didn't know what I wanted to do with my life, but I did know that I wanted to go to college and have a career, because there was just no way that my family was going to suffer and live in poverty the way I did when I was young. And so I went to a very poor public school. I got by okay. I had decent grades, but when I went to college, it was a very eye-opening experience. And so I worked hard. I worked 2 jobs while I was going to school full time. And I didn't immediately know that I wanted to go to medical school. In fact, because of my severe imposter syndrome and thinking that someone like me couldn't possibly go to medical school, it was a last route. I thought I was going to go to physical therapy school, and then I thought I'd go to nursing school, and then I thought I'd apply to PA school, and then finally I came full circle and decided I was going to apply to medical school. So I did what every astute student would do. I joined the pre-med society. I started volunteering, and I had been doing some volunteer work, but doing it in other areas, and because I thought I was going to go into physical therapy and so forth. And to make a very long story short, I started volunteering and doing rounds with a physician at the Health Science Center. And after about 2 weeks, he said, I think you would do really great in medical school. I want to introduce you to, I'm just going to call him Dr. Smith. Dr. Smith, who is the head of the medical school here. So I said, okay, great. So I went to meet Dr. Smith, and he says, yeah, well, I hear that you're a very great student, and that, you seemed very interested, and you actually have a knowledge base more than a lot of people that volunteer. So that's all really great. How did you do on your MCAT? And I said, well, I didn't do very well. And back then, Erkeda, I don't know about you, but when I took the MCAT, the score was a high score of 45, and you had a score of 15 on 3 different sections. And so he said, well, how did you do? And I said, I did not do good on the reading part. I did actually really bad. And he said, well, come out with it. How did you do? And I said, I got a 13. And he said, well, that's not so bad. How did you do on the rest of the test? And I said, no, I got a 13 total. That was my total score. And so I probably got the world's lowest score on the reading. It was a 3. And then I got a 5 and a 5. And he said, it was just so shocking to me. I mean, I can literally feel like my heartbeat picking up right now as I'm telling this story, because I actually have never told this story. But he said, well, I wish you hadn't wasted our time. You could have just started with that, and we could have told you that this isn't the place for you. And it was a really just shocking experience. And it took every bit of my soul to just not burst into tears in front of him. And so I said, well, I'm sorry if I wasted your time, but I do appreciate the experience, and I appreciate your input, but I have worked so hard for this, and I'm going to apply anyway. And if I don't get in this year, I'm going to apply next year too. And he said, well, you can waste your money if you want, but my opinion is you're not going to get in, and you're better off waiting until you can improve that test score. And so that was my journey to my first year applying. And to not keep you in suspense any further, I applied and I did get in my very first year.
That's awesome. And I definitely appreciate your transparency, because a lot of times when students go and they see these doctors that they're shadowing or that they look up to and things like that, they don't know the story behind it. And there's a lot of struggle. When you mentioned the 45 and all, I remember that because I got an 18. So I wasn't too far off. And I got in on my first time too. So it's discouraging, like how many people would have let that person tell them no. Sometimes you just have to stand up and advocate for yourself. And if one avenue doesn't work, try a different one. It's okay. Like that's a part of the journey. And you mentioned that there was some imposter syndrome that you overcame. And that's just amazing, because a lot of us, we do try to say, when we're all awesome, and you could have been an awesome nurse, an awesome physical therapist. We need all of those professions, but sometimes you telling yourself no could have prohibited you from applying to medical school or even shadowing that doctor. And then when you met with that dean, his no could have been the final say, but no, you had it a different way. So I really appreciate your transparency.
Yeah. I always, whenever I talk to people, I started giving wellness talks at my institution to nurses that I work with. And one of the things there are two really important things that I always share. Number one is be careful with your naysayers, because you have so many people around you, friends, family, mentors, people you work with that are going to have opinions. And I always tell people, you keep the naysayers on your left hand, and the people that are going to lift you up, you keep those in your right hand, and you listen to them, and you turn to those people when you need encouragement, when you need someone to help you get back on track, because inevitably we're all human. We all have limiting beliefs, and sometimes those can derail us for a long time. So knowing who those people on your right hand are very important, because if you turn to the wrong person for advice and you get that piece of advice, it can change the entire trajectory of where you're going. And then the second thing I like to tell people is, do not compare yourself to others. Had I been comparing myself to others as I was preparing for medical school, I probably would have gotten cold feet and not gone forward. But I told myself, look, nobody has had to live the kind of life I've lived. I guarantee nobody else that applies, at least that I knew, I'm sure it exists somewhere, worked 2 full-time jobs while going to school full-time and volunteering and applied to medical school. I would find that really hard to believe that someone that's applying to any given school that I'm applying to also had that. So I say, don't compare yourself to others, because I like to give the analogy of climbing a mountain. Erkeda, if you're on one side of the mountain and I'm on the other side of the mountain, and I'm climbing up and I fall down, and I climb up and I fall down, and this happens 50 times. And I finally get up to the top of the mountain and I have all these cuts and bruises and scrapes. And I look down at you and say, Erkeda, what are you doing? It's so great up here. You should totally get up here. You might look up at me and say, well, yeah, that would be nice if I could, but I can't. And it's so easy for you, but I have tried and I just can't climb this mountain. But what you didn't see were all the falls, all the tumbles, all the scrapes, all the bruises. So if you're comparing yourself to who you see that's successful, that's done what you want to do, you're not seeing the full picture. It's like Facebook. It's like social media. You're seeing the very polished presentation. And so I always say, avoid comparison at all costs. Comparison is really the enemy of joy in my book. So
I love that. Those are great examples, because number one, you can't compare yourself, because a lot of times we need the individuality and the uniqueness. We see the situation that we're in now in healthcare, where everything is viewed as a monolith when it's not. And
Right.
we need those people who have those different perspectives of having to be working class, coming from different communities, having used the public education system and all of that, so we can connect with our patients and we can impact it from a higher level as well, because we need the empathy there. Long story short.
Right. I will tell you, when seeing patients, it really gave me a very different perspective when you come from the background that I did, when you come from the struggle, when you come from, not having food, not having resources. And social determinants of health, now we know in medicine, is a huge thing, and that is costing our patients their health. And so being aware of the dynamic, and that's why I personally believe, and I've made the shift in person-centered wellness, meaning that we take into account the entire individual, their circumstances, the trials and tribulations that they've encountered, their environments, their relationships, their beliefs. All of that is tied into our personal health and well-being. And when we're looking at just the strict science behind it, and we fail to incorporate all of those other variables and other factors, then we're really doing a disservice to our patients. And having the background I did has enabled me to see that a little bit more easily, I think.
Absolutely. There's so much more to a patient as a person than there is a textbook. Like, there can be two people with diabetes, and one can be diagnosed, start their medicines, and improve within 6 months or a year. And then the other one can keep getting worse and not improve at all. But when you think about it, things like you mentioned, like food insecurity and job stability, like if you have a person who is looking to, you told them about medicines and eating healthy and things, they don't have a grocery store in their neighborhood, they have to choose between feeding their children or buying their medicines, they're not going to do as well. So you have to take a step back and kind of think about the person and what barriers they have. And you might need to tweak that management because it needs to be something that's attainable by the person.
Absolutely. And this is something that I think all doctors are facing today when they're managing their patients, is these circumstances, because even patients who historically have not had challenges in the COVID environment, who've lost their jobs, who've lost their livelihood, who've had to, give up their work to stay home with their kids, it's a real problem for many more patients today than it ever has been historically.
Yes.
At Med School Coach, we know that getting into medical school is hard. In fact, 60% of pre-meds who apply to a medical school don't even get accepted. And if you want to get accepted into a top medical school, it's even harder. That's why more students than ever are turning to MCAT tutoring by Med School Coach. Our tutors are all 99th percentile scorers, have been through rigorous training, and can help raise your MCAT score by 12 points or more. You need every competitive advantage you can get to get into med school, so why not get one-on-one tutoring from Med School Coach? Our expert team will create a custom program just for you and help you master MCAT content where you need the help most. You'll raise your MCAT score. We guarantee it. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach MCAT tutoring package. You can achieve your medical school dreams, and Med School Coach can help.
And we mentioned that you were thinking about patient-centered wellness in the back of your mind when you're seeing your patients, but you also mentioned that you talk about wellness in healthcare workers. Why do you think that it's important to highlight wellness in healthcare workers?
Yeah, well, this is a good direction to take this conversation, because I actually had a shift in what I do back in 2018. So in 2018, I was living a very unhealthy professional life. And I say that because I had come to the point where my job was everything. So the things that served me well when I was younger, working hard, not giving up, working longer, studying harder at the expense of my sleep, not exercising, not sleeping, not eating right, those I could get by with when I was younger and more resilient and had more reserve. And so I practiced as a hospitalist for 10 years. And then in 2018, I started feeling the physical effects, profound physical effects. I was having neck and shoulder pain all the time. I was having really bad headaches every single time I was on hospital service. And it really got to the point where I said, is this how I want my life to be? And as I was rounding one day, I said, oh my goodness, I literally am preaching to these patients about what they need to do to take care of themselves. And I'm not doing it at all. And so, I very well can see myself becoming one of these patients. So I don't know if you've heard this, but the lifespan of a hospitalist is about 10 years and before they burn out and get out. And I was at that 10-year mark, and I had started working a second job doing clinical documentation, education, and chart reviews within my institution. And so that was actually a turning point where I had always had this fear of getting out of clinical medicine, fear that I wasn't ready, the what ifs, those wild what if stories we tell ourselves. And at that point in 2018, I decided to make myself a priority. And I said I was going to shift my career path and I was going to move from clinical to non-clinical. So at that point, I made a shift to this non-clinical work and I started making myself a priority. So I know that, I think it's a myth that you can balance it all. Something has to give somewhere in order to return to some kind of semblance of balance. And it's never going to be perfectly balanced. But for me and having young children at that time, I knew it was time to make a shift. Mm-hmm. And so I made that shift and I started making myself a priority. And in doing so, I had this job where I actually enjoyed. I did physician education and produced education for our physicians around clinical documentation. I was in the charts. I was reviewing the charts. I was seeing what was going on. I was staying up to date on the medical aspect of it, but I was completely not fulfilled. I said, my goodness, I have this job. I'm not stressed out. I have more time with my family. I'm taking care of myself better, but I don't feel like I am contributing in a significant way to mankind. I really didn't. And as I was going through this job, and at that time, I didn't have an idea of what I was going to do or how I was going to scratch that itch. And so I also had the responsibility of hiring nurses onto my team to do the same thing that I was doing. And I would have these nurses that would come out of clinical medicine or would come out of another job and they would be so excited and this is the best job ever. And then fast forward, 6 months, a year later, I kind of saw them falling into the same path of, not quite happy, not quite fulfilled, except the subtle difference was I was doing okay because I was healthier. I was happier. I was more energetic. I was taking care of myself. So then I said, I'm going to start talking to them about making that shift and taking care of themselves and how that can help them personally and professionally. And all of a sudden, I just found this new area where I was actually making a difference. I was helping them. This aha moment was happening for them. I had people come back 6 months later saying, I lost 30 pounds, or wow, I've done so much better now that I made this shift. Or wow, I signed up for my first marathon because of you. Just all kinds of crazy stuff. And that's where I discovered that my voice was what was giving me that opportunity to scratch that itch and help others. And so that was kind of how that pathway led. And it's like you said earlier, Erkeda, sometimes you're going in one direction and then you kind of redirect to another direction and then you find yourself going in another direction. And I fully believe that the path to success is definitely not a straight line up. Mm-hmm. You have a lot of different turns and tangents and ups and downs until you find that place where you feel like you're supposed to be. And that's where I am today. And I'm still growing and I'm still, putting myself out there and trying to grow and expand as a speaker. And to me, it has been just such a growth journey, but it has definitely not been a straight path.
I love that story because a lot of times, I don't know if it's like that certain year itch that you get when you leave. But a lot of my friends talk about wanting to change. And I love that you not only talked about that, but you acknowledged it. You figured out what your priorities were. So you being more healthy, you spending more time with your family, and you kind of, you pivoted to something else. But then when you were seeking more, because you weren't feeling as fulfilled with the documentation, you didn't kind of say, okay, well, I guess I need to go back to the thing I hated. You figured out something else, and you were able to utilize those skills that we get as physicians and train as to treat someone else, and not necessarily in a doctor-patient relationship, but in an educational manner through your speaking. So I think that's really important, because a lot of people who train in medicine, we train for so long. College, med school, some people do post-bacs, then you have to do residency, and then it's just medicine. And they think that there was a time I was talking to some friends before, and they were like, honestly, all I know how to do is medicine. Like, I can't even really get a job at Starbucks. And that's not true. You have so many soft skills that are transferable that their possibilities are endless. So it's just all about kind of figuring out what you want to do and how you can contribute to society, because now you have whole departments coming up to you and making themselves healthier so that they can go and care for others.
Right. Yeah, it has been a journey. And I think that, brings another important point. A lot of people think whenever you pursue a certain area that you're, quote, stuck. You are never stuck. And that was something that my husband told me over and over again for years. You're never stuck. And I was, I couldn't get it at the time. So we had made the decision after we had our first children. So I had twins in my first pregnancy. And we made the decision that my husband, who was a pharmacist, would become a stay-at-home dad. Mm-hmm. And that made me the primary breadwinner. And so he would say, you never have to do anything you don't want to. And I didn't get that at the time, because I was like, how can you say that? Of course I do. Who's going to bring home the money? I mean, are we going to switch roles or what? That's just, I could not see it through the fog. And again, that brings up the importance of self-wellness, because if I were less sleep deprived, if I were sleeping better, if I was exercising and more energetic, if I was eating properly and not eating just junk food I'm grabbing from the physician lounge, instead feeding myself nice, nutritious, plant-based meals, if I were doing those things at the time, I probably would have been in a much better position to receive that, hear it, and understand it. And so that is one thing that that is the one thing, if I could tell this audience that, I wish I had understood at that time, is how important prioritizing yourself and your wellness as an individual is. Because if not, you won't have the clarity to be able to tackle those really challenging situations that you come up with. You won't have the clarity when you're feeling sluggish and tired and run down. And it wasn't until I shifted course and I was less tired, I was less run down, that I was able to see it a little bit more clearly and was able to pivot. With that said, there are so many hospitalists. I was a hospitalist for 10 years. My first 4 years was really brutal. I worked 16 to 18-hour shifts. And then every third day, I worked a 30-hour shift. So I was just burning the midnight lamp all the time. And then I went back to the academic setting where I had a much more doable, patient census, patient load, not working crazy hours. But then I threw on top of that 3 kids, and then it became more challenging, right? Mm-hmm. So I don't want to discount the profession of hospital medicine, because I honestly still think there's great opportunity there. And I think that, prospective students looking at hospital medicine, I think it's a really great opportunity, and I enjoyed it while I did it. However, my shift, my personal growth, led to that shift in what was important to me. And that's what led to, a different path for me.
That's a great point that you bring up. And then for the listeners out there who may be pre-med let's just take a little step back and kind of explain what a hospitalist is and how is that different from working in an outpatient facility.
Yeah, absolutely. So hospitalist, so I trained in internal medicine. And so when you go the internal medicine route, you can work inpatient in the hospital, and that's called a hospitalist. And as a hospitalist, you only work in the hospital, and you see patients who are admitted to the hospital, you admit them, and you take care of them for their acute issues, and then you discharge them at the hospital, where they go then to their primary care doctor, who's typically an internist or a family practitioner. There are family practitioners, family medicine, who also work as hospitalists. There's not a whole lot of them out there, but I know that there are some, and there are some hospitals that hire family medicine into the hospitalist track. But in general, hospitalist is just a term used for physicians who work predominantly in the hospital. And there's another term, nocturnist, which is a hospitalist who works in the hospital but works at night. So nocturnist, those are the two terms.
Thank you for that. Yeah, hospital medicine is a really necessary field. And as we just mentioned, it can be family medicine, it can be internal medicine, it even can be some like pediatric hospitalists and things like that. So you'll get lots of exposure when you're in medical school and in residency of putting all that time in those overnight shifts to figure out if it's something that you want to do or not.
And it'll also be interesting to see how it evolves in time, because now there's transitional teams that are helping transition the patients out of the hospital, kind of that in between the hospital and primary care. There is a kind of a resurgence of home calls. Physicians that, especially in the COVID environment, are going to the patients' homes to check on them post-discharge before they get into their primary care physician for follow-up, just to make sure that they're still doing okay and prevent readmission to the hospital and so forth. And there's just all kinds of creativity that's going on right now, trying to develop different areas where we can help and serve our patients to, transition them from acute illness to kind of more sustained long-term wellness.
That makes sense.
At Med School Coach, we know that matching into the specialty of your choice and the residency program of your dreams has a dramatic impact on your career as a physician. And your USMLE score is the most important acceptance factor of all. That's why more students than ever are turning to Med School Coach for USMLE tutoring. Our tutors are all 260 plus scorers and have been through rigorous training. Plus, the average student who uses Med School Coach tutoring raises their score by 23 to 55 points. There is an enormous amount of material you need to know for Step 1 and Step 2, and Med School Coach can help you be smart about how to study. We'll create a custom program just for you. Then, we'll help you master USMLE concepts where you need help most. You'll raise your USMLE score. We guarantee it. Visit us online at medschoolcoach.com and use offer code PODCAST10 to save 10% up to $400 on a Med School Coach USMLE tutoring package. You can achieve your medical school dreams, and Med School Coach can help.
So for one of my final questions, we've talked a lot about how you've kind of shifted your life into a state of wellness for yourself and how you've been educating a lot of healthcare workers. How would you suggest that students who may not have as much say in their time or their schedule put wellness first during this period that they're in?
Yeah, that's a great question. So I will tell you, as a student, even as a resident, even as an attending, it's almost like you never feel like you have enough time. Even when you talk to really established people who have created their own businesses, who have, created programs and just done so much awesome stuff, they will tell you, time is a precious resource and it's hard to come by. And so what I say is you have to be able to say no to the things that are less important to you, to be able to say yes to the things that are more important to you. And trust me, saying yes is way easier than saying no. And that is number one important thing I would say. And number two is if you don't make time for your health now, you will be forced to make time for your illness later. And we are, as healthcare professionals, are the absolute worst about taking care of ourselves and prioritizing ourselves. And this has become a very recognized thing. So in our healthcare system where I work now, we are required to have an annual exam. And by making it a requirement, I say what they do is they knock off like $40 per pay period for what you pay for your insurance. Mm-hmm. So you don't have to go get your annual exam, but if you don't, your health insurance is going to cost you a lot more. And so that has kind of been a workaround because we know that we'll neglect ourselves. But I would say really just start with the little things. I always have water with me, always. Now I do, because I realized that part of my headache problem was that I was not drinking water all day long. So first thing in the morning, I drink 8 ounces of water, no matter what. That's the first thing I do in the morning. And then I always take some time for myself in the morning, because even if I don't have time the rest of the day, if I did it at the very beginning, then it really starts my day in a positive direction. So one thing I would recommend, a book that the students could read, is called The Miracle Morning by Elrod. I don't know if you've heard of this book or talked about it on this podcast, but it's called The Miracle Morning by Elrod. And what he did, he created a whole series of these books, The Miracle Chef and The Miracle Parent and all that kind of stuff. But The Miracle Morning talks about how you can start your morning dedicated to yourself and become really a person who prioritizes themselves. So in The Miracle Morning, he teaches the savers, which are to have a moment of silence, whether that's prayer or meditation or what have you. Say affirmations. We have these wild imaginations where we create the worst case picture in our heads. If I take time to exercise, then I'm going to be running late and I'm not going to get to morning report on time or whatever. So affirmations are just reminding yourself that you are great, you are strong, you are capable, and so forth. V is visualizing yourself doing it. If you can't see yourself doing it, then how are you actually going to do it? You have to see yourself doing it, believe that you can do it. Exercise, even if that's 10 push-ups. I will tell you, I started doing 10 push-ups every morning that I don't do a real workout. So 10 push-ups. And then if I don't have time to exercise the rest of the day, I do 10 push-ups at breakfast or in the morning, lunch, and in the evening. That's my workout for the day. And then R is reading something productive for yourself, whether it's positive quotes, 10 minutes or 5 minutes reading something that's going to help you grow as an individual and so forth. And then let's see, the S is scribing, writing about your journey, reminding yourself what you're grateful for, reminding yourself what went well, what you could have done differently, and so forth. So the way he teaches it, you can take as little as 10 minutes a day, 1 minute for each of those. And it really will shift the trajectory of your day by taking that time out for self-care. So, yeah.
I love that. Maybe our producer may put the link to the book in our show notes if you guys are listening. The Miracle Morning.
Yes, The Miracle Morning.
And for our listeners out there, we're so thankful that you were able to join us. How can one get in contact with you if they had any questions about like hospital medicine, or if they wanted to book you for a speaking engagement or talk about wellness?
Oh, yeah. Well, I just launched my speaking website because this is a new journey for me. I actually have been doing it at my institution, but now I'm officially launched as a professional speaker. So you can find me at lizaguirremd.com. I'm also on Facebook predominantly and LinkedIn, but I also do dabble in Instagram a little bit, but Facebook is my primary platform. And I actually, for the students who are on Facebook, go ahead and add me as a friend and send me a message and let me know you heard me on this podcast. I do try every morning to post something, or at least during the day at some point, post something that's helpful to people who follow me, whether it's a Facebook Live, given a quick tidbit, something that I've read, something that's been helpful for me. This month, I'm actually doing a yoga challenge at work where I picked a YouTube video, and it's anywhere between 5 and 20 minutes. and I post the video that we're doing for the day, and we all do that same video. And then we talk about it afterward, which is super fun. Like, yeah, that one post was super hard. But yeah, so if you look for me on Facebook, I'm always trying to put information out there that helps others, because the path was long and hard for me. And my goal is really to share my knowledge that I've gained with others.
Well, thank you so much. And for the listeners out there, definitely check out those pages. And we're going to say goodbye now.
All right. Bye, everybody. Thank you.
All the listeners, be sure to click that subscribe button, and I'll chat with you next week with a new guest. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward medical school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.